Um, so for this project, I decided to do a video over autoimmune diseases. And what autoimmune diseases are is humoral and cell-mediated immune responses directed towards self-antigens. So this can cause all different kinds of tissue and organ damage throughout the body. And there's two different kinds of autoimmune diseases that you can have, which is systemic or organ specific, and I will give you two great examples in how to lab test for this later on. So the first one, there's also over 100 diseases that have been discovered for autoimmune disease. And like I said, there's two different types, the systemic diseases and the organ specific. So an example of the systemic autoimmune disease is lupus. And lupus is a chronic systemic inflammatory disease that affects multiple organ systems. So it affects throughout your whole body. It's not just one thing, as I will talk about later with diabetes type 1 as an example for an organ-specific autoimmune disease. So during this, patients with lupus develop numerous autoantibodies. Some of the clinical symptoms of lupus involves joint pain and skin rashes, renal involvement, neurological symptoms, anemia, leukopenia, or thrombocytopenia. So for lab testing for this to diagnose lupus that could help you could be something as simple as a urinalysis, or you might use a CBC or look and do ANAs. So anti-nuclear antibodies are present in more than 95% of lupus patients, so this is a really good thing to look for since it is so common. In order to do this testing in the lab, you would incubate the patient's serum with the Hep2 cells fixed onto the microscope slide, and then after that you would wash and incubate with fluorescence labeled anti-human IgG. And then after this you would wash, and then you would view the slides under a fluorescent microscope to get your results and to be able to tell. An example of a organ-specific disease, like I said earlier that I've talked about, would be type 1 diabetes. So this is a disorder characterized by hyperglycemia. So type 1 diabetes is the destruction of B cells in the pancreas, and this results in an insulin deficiency. So unlike the other, it just has to do with the pancreas and not with multiple organs throughout the body. The long-term effects for type 1 diabetes can be cardiovascular disease, kidney dysfunction, nerve damage, and blindness. So some of the lab tests that you can use to help be able to figure out if they have type 1 diabetes is look for increased glucose levels in their blood, elevated HbA1c or autoantibodies, GAD, and IA2. Another one is